We interrupt your scheduled program for breaking news. Live from Studio 54, here's your anchor, Ricky 6.
Good afternoon. Breaking news in Los Angeles. A recent outbreak of scabies, lice, and impetigo at a local college dorm has students stunned. At the scene with more information is Misty Waters. Misty?
I'm standing here in front of the college dorm where this outbreak is taking place. As you can see, there are health officials and campus employees on site surveying the area right now. But let's take you back to how this all got started. It was a regular quiet Monday morning on this Los Angeles college campus when a significant number of students came into the Student Health Center complaining of severe itching, redness, and bumps. Employees at the Student Health Center noticed the trend in these students and immediately contacted local health officials. Here I have one of the students that actually lived in the dormitories, whose roommate was actually an infected student. How is it living in the dorms?
Oh my God, let me tell you something. My roommate, God bless her soul, would not stop scratching her crotch during the game. And she was telling me how she was red and bumpy all over, and I did not want to hear this. Because, go Chargers! Yeah!
And how about you, sir? How is it living in the dorm for you?
I'm just glad I didn't share my brush with those people.
Earlier today, I spoke with a public health nurse who was one of the health officials present at the dormitories. I asked her about what her role was during this event.
Well, as a public health nurse, I perform many roles. I'm a clinician, educator, an advocate, manager, collaborator, leader, and researcher. As a clinician, I make sure that the health services are provided to the community. As an educator, I act as a health teacher and promote illness prevention and health promotion. Like in this situation, I would educate the community on prevention and the reduction of spread of impetigo, scabies, and lice by avoiding direct contact and sharing of items with people who are infested. As an advocate, I make sure everyone receives just, equal, and humane treatment, especially those that are poor, disadvantaged, with no insurance, or those with a language barrier. I show that services are available, those to which they are entitled to, and how to obtain them, in order to gain greater independence so that they may seek out services themselves. As a manager, I assess clients' needs, plan and organize to meet those needs, direct and lead to achieve results, and control and evaluate the process to ensure that goals are met. I have to collaborate with others to achieve a common goal. In this situation, I had to work with the school's health center, the school, hospital, the local health authority, and the CDC to report this outbreak. As a leader, I have to initiate changes that will positively affect people's health and that influence people to think and behave differently about their health and the factors contributing to it. As a researcher, I engage in systemic investigation, collection, and analysis of data for solving problems and enhancing community health practice. And that's just a few things I do from a day-to-day practice.
We wanted to get a closer look as to how these diseases affect the human body. So one of the students agreed to have an interview on the condition that her identity be kept a secret.
Okay, so what brought me here? Well, a week ago, my head just started itching and my whole body basically and my arms. And then when I came here, they said that I have lice and scabies. And so they're treating my lice with Nix and permethrin. And now the scabies, they're treating it with permethrin and they're scraping the mites out of my skin. But now I have to stay here longer in the hospital because I developed a complication. I had a systemic infection, I think that's what it's called. Now I'm really like sick that I don't know, I don't know how this happened to me. I mean, help me.
Back in the studio, live with Ricky 6, here's Charlie Brown, doctor specialist, who's going to talk to us about how to protect yourself from this outbreak.
Thank you, Charlie Brown, for joining us. Are these diseases preventable?
Well, yes, but surprisingly, many feel that those with poor living conditions are more likely to be infected. But in reality, all people can be infected. It's more important to understand that those who are constantly in close proximity with one another are more likely to infect others if direct contact is there. Examples of these places include daycare centers, senior centers, and dormitories.
What warning signs should people look out for?
Yes, the signs to look out for especially is itching, also skin irritation, and redness and sores. These are the signs that you must watch out for.
What can people do at home to prevent getting this disease?
Taking steps such as hand washing on a regular basis and personal hygiene can be important. It is also important to avoid direct contact with this person who might be infected. Remember, sharing clothing or items used by this person is also important to avoid. These items must also be disposed of or properly washed in high degree temperatures. Also, it's important for the family member to contact if anyone in the family has an outbreak. You may contact the local health authority to follow up for treatment or for the individual Also, other family members would want to be screened because this can prevent the likelihood of others being reinfected. You can call for more information by calling 211 or visit www.211lacounty.org for more information.
Thank you, Charlie Brown.
Currently, the dormitory has been closed and public health officials are surveying the area. All of the students have gone to local hospitals to begin treatment. Our sources tell us that all of the students are going to be interviewed so that the health officials can identify where this outbreak came from.
Misty, has there been any confusion when diagnosing these diseases? I mean, from listening to the specialist, the diseases sound kind of similar.
From what I understand, after conducting these interviews, these three diseases are very similar. Impetigo, scabies, and lice are an infestation that affects the superficial portion of the human body, like the skin and hair, and can manifest on any portion of the body. These manifestations are all easily visible and include severe itching and redness on the affected area. Also, they are all highly contagious, and cross-contamination occurs through the direct and indirect contact with an infested person. The threat for communicability are all the same, which is as long as the agent remains viable to the infected person, anyone is susceptible to all three of these diseases. And the similar complications are dermal hypersensitivity when repeatedly exposed to these diseases. The methods of control and treatment are also very similar.
So how is differentiating these diseases possible?
From what I understand, there are key concepts to each of these diseases that are unique. For instance, impetigo is caused by Staphylococcus or group A strep. It appears as a vesicle, so it looks like a localized collection of pustules on the skin that's filled with honey-colored fluid. These vesicles burst and sometimes crust over, so diagnosis contains culture and sensitivity. Treatment is with an antibiotic to take care of the disease. Lice are caused by parasites that infect people and live in the hair on the scalp, eyebrows, eyelashes, and pubic area. Diagnosis is through history and physical. Treatment is using a specific medication to take care of the disease. And scabies is caused by mites. It is identified with papules and vesicles with tiny linear burrows that contain the actual mites and their eggs. These lesions mostly occur on the wrists, elbows, belt line, thighs, abdomen, and buttocks. Diagnosis is through microscopic identification of the mites and eggs. And treatment is using scraping and biopsy.
Oh, that clears things up. Thanks, Misty.
Anytime. I'm Misty Waters reporting for Health Watch. Back to you in the studio.
For more information on these diseases and to stay up to date on this outbreak, please go to our website. We now return you to your regular scheduled programming.